Google screwed it up. 'Cause Friday night the WTIP wasn't able to live stream because Google had changed the portal entry somehow and it screwed up live streaming all over the country.
Oh no, really?
So I wonder if that's this is
Well,
part of
mine
that.
isn't working.
Yeah, they changed their passwords and everything without telling you.
They're hard to get a hold of.
I'm not sure.
You have to be on hold for several years.
Yeah. Right when my internet goes down.
I wanted to get a hold of them for the hours for the
Yes, sir.
museum, because it's not correct. So then people are saying, but I Googled and it says.
Melissa, we're just.
So then I say, well, just go to our
We're working on an issue with
website.
the live stream for the meeting right now.
We'll try to be more accurate.
So we'll get the
And
meeting
you've got a
started
big
as soon as
weekend
we're
on your
able
way,
to
don't
get
you?
the.
It's really
Yes,
days
sure
away.
is this weekend, and then our celebration is in September. 25 years. It's a lot of hanging around.
Thank you.
I don't know if I want that pointed right at me.
It's kind of everywhere.
It looks all around.
Yeah.
I'm the one who gets the extra close up.
It's got that head.
Yeah, you're mostly off camera
Yeah,
there.
you can't even really see us very well.
Does it rotate or is it just looking at you?
It rotates based on who is talking in theory, but I
Oh.
think if we were doing this for more than just a quick introduction, I would probably put it in the center of the room so
Yeah.
that we get a better view of everyone.
It's pretty impressive how it works. It's
Yeah.
yeah.
I suppose I could put it over here. Let's see.
It's just all-
That's a little disappointing, but. Is that better? I don't think so.
Oh.
Sorry, not for me, but, okay, we're ready to go with the live stream.
Okay.
Happen.
All right, I'll call the Public Health and Human Services Board to order on Tuesday, August 17th. We have a consent agenda, and I want to acknowledge that we have a new person going to join our board for next month. And so, anybody want to pull anything or talk about anything on the consent agenda?
Madam Chair, I'd make a motion to approve the consent agenda.
Thank you. We have a motion. Is there a second?
I'll
Thank
second,
you.
Madam Chair.
Motion is made and, all in favor, sorry. I've got other things in my mind. Aye.
Aye.
Those opposed? Yes, motion passes. All right, and we have joining us this morning our new substance use disorder, co-occurring disorder case manager by Zoom. And so, thank you, Melissa, for being here and agreeing to meet us all. It's kind of hard to do this over Zoom, but welcome.
No sound.
We aren't able to hear you, Melissa. I think you're on mute.
Oh yeah.
Oh, sorry. Thank you. I was just going to say that was a little bit challenging to hear, but I think that was the introduction.
That was.
Is it my turn?
Yeah. Welcome, Melissa. We're really glad to have you on board. Thanks for trying a new technology with us to connect for your introduction this morning. And we're just really excited to have you here in this role and all the skills and experience you bring. So if there's anything else you'd like to say to the board, this is...
Yeah. Hi. I'm so excited to be here. I'm not sure. I think I read in the email that Grace might be in that room. I also want to extend a thank you to her. Just so grateful for this opportunity. My partner and I are really excited to be moving to the North Shore and bringing hopefully some well-needed skills that are sort of in areas that are needed and lacking or sparse right now for the mental health area. And just really excited to come. We've been working toward this for a long time, so I'm grateful for this opportunity and can't wait to meet all of you in the room in person and work hand in hand in the community.
Thank you. Can you tell us a little bit about your background and what made you want to come to Grand Marais?
Yeah, my background. So I I actually coached collegiate softball for 10 years at Loyola University in Chicago, and then I moved over to University of Wisconsin-Madison after playing professional. So hopefully going to be able to maybe get into the softball area in town at some point. But from coaching, life on the road, a lot of recruiting, weekends, nights, I sort of had to come to what was I looking for in the bigger picture of my life. So I got into social work. I went to grad school. I moved home here to Minneapolis. I went to grad school at St. Thomas, finishing in 2017. In 2015, I started my internship, so I did some work with child protection at the Mitchell Hamlin Child Protection Clinic, working with moms who had recently lost their kids within the 72-hour window, and then worked with them to gain their kids back or not, work with services to help sort of transition that. And then from there, I moved over to North Memorial, which is a level 1 trauma center, working in discharge planning throughout the hospital, and then ended up transitioning into the emergency room to do more crisis work, working with individuals who just sort of, some big event had happened, transitioning of services they needed at that point, or really just sort of getting them into more of the mental health psychiatric arena. And when that had, really I felt like I had learned enough skills in that manner. I felt like I was lacking in the clinical, so at that point I wanted to learn more, and I moved over to the outpatient mental health clinic at North Memorial. So pre-COVID, so 2018, I started doing therapy in the partial hospitalization IOP program, which is intensive outpatient program. So those who were in risk of being hospitalized or recently discharged from the hospital due to possible suicide ideation or attempt. So the SPMI population, so severe persistent mental illness, worked with that until COVID, which then the programming had stopped. And I transitioned to just doing individual therapy and dialectical behavioral therapy, which is called DBT, a different module of group therapy. And so at that point, when I saw up north, I really thought the skills could translate and help as far as the substance use, which I see a lot with those who have trauma and sort of a backbone, especially even in the child protection. It just sort of all blends together. So I was really hoping to draw parallels from my experience and really bring that up there and help out.
Thank you. Welcome. We're excited. We'll be excited to see you in person, hopefully soon. Do you have plans when you're going to be making the move up?
Yeah, so we thankfully have a house. So we will be closing on that on or before the 17th of September. We close on our house here on August 31st. So I'll do a little bit of back and forth, but my goal, and with Grace's goal too, is September 20th to be there full-time in person.
Well, great. We look forward to having you here and meeting you in person. Thank you very much for joining us this morning.
Thank you so much, Melissa.
Yeah, thank you for the opportunity to introduce myself.
Yeah,
I look forward to seeing all of you.
Have a great rest of your day. Thank you.
Thank you.
Thank you. Bye-bye.
Okay, next on our agenda is our staff report from Sarah and our transportation access report.
Yes.
Turn it all over.
Hi, my name is Sarah McLeod while she gets that set up. I've been interning here since earlier this year. Originally I'm from Georgia, but I moved up here a few years ago for a summer job, and I loved it so much that I've been living here on and off ever since. And now I am currently working on my master's degree online, and that's how I ended up here. Martina and Grace, they've had me working on looking at some of the transportation barriers and the healthcare access barriers in Cook County. And so we did some research. I've been looking into other rural communities in the U.S. just to see like what they've been up to, and it's a hard issue to solve, but as kind of a first step to addressing some of the issues in Cook County, we wanted to get the community's input. So we put out a community survey to gather some data, and I just wanted to go over the results of that with you guys here. I'll kind of go over each of the questions and give you a summary of what the responses were, but we conducted the survey primarily electronically. We ended up with 127 responses. There were also the option for people to fill out the surveys. There were paper copies in 3 places around Cook County, and my email and my phone number were also left so people could call and I could walk them through the survey if they needed. But the first question we asked was, where are Cook County residents primarily receiving their care? And we had them answer for 8 different categories of health care: primary care, dental care, eye care, specialty care, behavioral health, chemical services, psychiatry, and then just other. And what we found was that Cook County residents, they're receiving primary care and dental care primarily in Cook County. Behavioral health was split pretty 50-50, but leaning a little bit towards outside of the county. And then eye care, specialty care, chemical health, psychiatry, and other, those were all very much out of the county, and I'll show you my charts here. So you can see it's split by how far people are traveling, so less than 10 miles, more than 10 miles, more than 50 miles, more than 100, more than 250, and this is kind of the breakdown. So primary care, dental care, people are receiving their care within the county, and then specialty eye care very much outside of the county. And same here, most people responded not applicable, but those who did respond, leaning more towards outside of the county. The next question we wanted to ask was how often people are having to leave the county to access health care. And 89% of people said that they're traveling outside of Cook County at least once per year, and over 50% said they're traveling outside of Cook County at least 3 times a year to receive health care. We also asked, whenever people do need to leave the county to access health care, if they need assistance, so either transportation or like physical assistance getting in and out of appointments. And 32.3% of our responses said that they do need assistance either with transportation or with like physical help. We then asked about overnight lodging, so whenever people are traveling, how often do they have to stay overnight, if the cost is covered by their insurance, those sort of things. And over 75% said they have needed lodging whenever they're traveling outside of Cook County to receive health care. And of those 75%, 19.3 need lodging every time that they travel for health care. And then for the cost, less than 2% said that their insurance covers the cost of lodging whenever they're traveling to receive health care. 67.5% said that they're paying more than $50 a night, and 43.1% said that they're paying more than $100 a night whenever they're traveling to receive health care. We then asked a little bit about public transportation challenges. First, we had just people rate on a scale of very easy, somewhat challenging, very challenging, what they perceive, like how they perceive utilizing our public transportation to be. We have Arrowhead Transit, and we kind of just wanted to get a feel for how the residents perceive that service. And of the people who had experience using Arrowhead Transit or the public transportation, 90.3% rated the ease of access as either somewhat challenging or very challenging. So 9.7% said that they found it easy to use. And then we had people list like what they perceived the challenge to be. So we had a list of things that they could select, or they could write in their own comments. And the biggest challenges that they said, the top 4, number 1 was limited route options. And then the next 3 were tied: difficulty with scheduling ride pickups, uncertainty about ride options, and then the time it takes to travel using public transportation. A couple of the other notable responses were the cost, and then people concerned about their mobility needs using public transportation. The next thing we asked was like what concerns people have whenever they're traveling to access healthcare. By far, the biggest concern people had was road conditions and weather conditions. 67% of our responders said that that was a concern for them. And then 3 other big categories were like the energy it takes to drive back and forth, difficulty finding someone to drive, or the cost of lodging whenever they receive medical appointment care. And a couple of the other notable categories were affording the cost of meals and gas, and then like concerns about reliability of their vehicle, sorry. And then at the end of the survey, we left a place for people to just leave their comments and suggestions, and then I kind of put them into categories. And the 2 big categories that emerged were people suggested that we expand access to local services via telehealth or like monthly visits from external practitioners. We saw several times that people suggested bringing optometry back, like having someone come in once a month, birthing services, and then several people suggested telehealth, expanding that option. And the other big category of suggestions was enhancing local public transportation options, which with a county like Cook County, I know that's easier said than done. All of this is easier said than done, but we just kind of wanted to get an idea of what people are experiencing, what people are thinking, so we can move forward from here. I also conducted a few extended interviews, so people could leave their name and their phone number or email, and I reached out and we just had a conversation, get some narrative and get people's stories. For the most part, it was like expanding on the comments and suggestions. People were just telling me about their frustrations with accessing specific services. But there were a lot of stories from people who really struggled when it came to receiving like long-term care for cancer or for just diseases that require repeated visits. Specifically, I heard several times when referring to cancer care, when people had to travel to Duluth and back every single day for weeks while receiving care, that was very, very difficult. One woman in particular said she had to cut her treatments short just because she couldn't take the toll of driving back and forth every day. So next steps with this information, it's just really beneficial to have the community input. We've been hearing from the social service practitioners for a while now that this has been an issue, but it's good to have the numbers down in a report. So we're planning first to just present this information to you guys and to other committees in Cook County. Going to communicate the results with the local transportation services. I know they're doing everything that they can already, but it's just good information to know. We're going to continue to research funding options and grant options, and then having this data will be good for grant proposals potentially in the future. We can say, here is the data, we actually know this is what our people are saying, this is what we need. So that's good to have. And yeah, I have a report available. Anyone who wants to look at it can. And yeah, this is their first step in finding a solution to this incredibly challenging issue.
Thank you.
Yeah.
I have a question about the methodology used for this survey, and what age group did you target? What was the age group of respondents?
Any Cook County resident, they were anonymous, so we didn't ask for ages or names or anything. So we really don't know. That's the big answer, is that we don't know the specific age group. It was any Cook County resident. There is a likelihood that it kind of geared toward the older population just because of the people who knew about the survey, but it was made available to everyone.
Yeah, and I 127 out of our whole county. It's like, okay, well, how much faith can we put into it? People like my dad, who do not have a computer, would not have done an electronic, and he probably, not going out in COVID now, wouldn't see a paper one. So I'm just curious. And then some of the responses, the majority of some of those answers came from less than 10 miles away from primary care or dental. And I'm like, okay, did we make sure we covered the whole county? Did you have a geographic area that these surveys? Do you know?
So for the first question, say again what you're asking, because the responses were like how far people are traveling to receive these services. So
Right.
whenever they said less than 10 miles, then they're living less than 10 miles away from dental or primary care.
Which made me think that maybe the majority of the respondents are probably within Grand Marais area, not Gunflint Trail or Hoagland or Grand Portage.
Possibly. We also had the less than 50 miles option, which was hopefully going to cover that,
Okay.
the larger area. But yeah, there's just a first step. There's room for improvement, and maybe we can conduct a wider survey later on.
Yeah. Yeah, it was an interesting to read, but that's like, okay, I
Yeah.
just was curious about, I always ask more questions, what's behind the numbers, so.
Sure.
Sure, and can I respond to that too as well, Commissioner
Yes,
Hawkins?
go ahead.
So in terms of targeting population, just the way that we dispersed this was we had an interview on WTIP, it was put on Facebook, it was put in the newspaper. So there were various ways that it was promoted. And then we also had paper surveys available in Lutzen, at Clearview, at the library in Grand Marais, and up at the trading post in Grand Portage.
And did you track those to know how
We
many of
did.
those came back?
Yeah, so we only received one paper survey back out
Okay.
of all those locations.
Mhm.
Yeah.
All right, thank you.
Any other questions?
Yeah, go ahead.
Yeah, I don't think I have any questions right now, but I was just very impressed with the presentation. So good job, thank you, and the results and the summary. I thought it was. I mean, I certainly hear that it'd be good to get more results. It always is good to get more, and then it's more accurate. But it's just very telling about some of the significant challenges of our community, and it really helps me better understand how and what and where to be targeting when we're talking about transportation or healthcare needs. And sitting on the hospital board, it gives me or representing the county at hospital board meetings, it gives me another perspective, just further insight into how to navigate things. And so I really appreciate it. Thank you for your work, and it seems like you've done it before, based on how well it was done, I thought. And just I hope, as Commissioner Hawkins said, or alluded to, once COVID is less prominent in the community, that we'll be able to do more, understand more. But just I really appreciated this approach, and I hope we can do more of it for other need assessments beyond transportation. But it's a really excellent first step in figuring out how to best address those needs. So thank you for your work there, and congratulations on a well-done project.
Thank you.
Yes, go ahead.
A question I have relates to safety. One of the comments that was put up there is that there were some individuals that were concerned about safety during transportation. In your extended interviews, were you able to identify, were they concerned about COVID and safety on Arrowhead Transit, or were they concerned about driving safety with road conditions and weather, things like that?
So I did have a few COVID concerns, but also I had a couple of people say that they were concerned about their safety just being on public transportation, being on the bus. They were just worried about being alone there.
Okay. Thank you very much.
Go ahead.
Yeah, just and where my mind goes was once we need more numbers and more accuracy, more data. But where my mind goes is just thinking about targeting those needs and just trying to brainstorm of solutions of how better address. And I read through all the comments and the extended interviews, and I really appreciated those too, just to get kind of further perspective on the answers. And it makes me think about, boy, what options are there? How great a need is this, and how can we make that feasible because, as you said, yes, it is easier said than done, but I gotta believe that there are ways that we can better meet those needs, whether it be a more, I guess targeted again is the word, mode of transportation on a certain date just for medical, as one comment was, or just trying to really be more proactive with our local healthcare providers to somehow contract outside specialists to come in on a scheduled day. I think our healthcare providers would very much appreciate this information as well. So I don't know if there's a plan or if it's been shared already, but I'd highly recommend that.
Yes, we did share this with the North Shore Healthcare Foundation.
Okay.
And we plan to continue to share it as we have the opportunity. So with other boards as well. And then we're also hoping to meet with Arrowhead Transit as well.
Would it be okay if I shared it with North Shore Health? Yeah. I'll just send it to them, and if they have questions, they can contact you. Yeah. Thank you.
Yep.
One thing I'm wondering about to tie in with this is how any planning would be done that would include transportation for people in mental health crises. I know that's been an issue over the years of getting people to psych units and to hospitals. And I'm hoping that this will include that kind of transportation as we plan forward.
Any other comments or questions? No? All right. Well, thank you. I appreciate your work on this and the nice report. Thank you for that.
Thank you for letting me come in today.
Thank you, Sarah.
All right. We'll move on to Allison.
Just want to echo the thanks and appreciation to Sarah McLeod for your work on this survey. I really appreciate you working with our department and helping us understand better understand the needs of people who are accessing healthcare transportation locally. So thank you to you. Thank you to Martina, who has provided a great deal of support to Sarah in her role in supervising the internship, and as well to Grace Bouchard, who in addition to our role as Children and Family Services Supervisor, also serves on the North Shore Healthcare Foundation and is providing that key link to the foundation as they also see this as one of their strategic priorities. So thank you all.
That's a congratulatory beep.
All right. Well, I'll start with a staff update. We are very excited to be welcoming Andrea Orest to the Public Health and Human Services Department. This was approved, for those of you who weren't present, this was approved at the August 10th Board of Commissioners meeting. Really excited to have Andrea on board. At the August 10th meeting, the regular Board of Commissioners, maybe if I turn the TV off, that won't keep happening.
I think it's each of our, maybe, okay.
We'll try.
Oh, yeah.
Also acknowledge the retirement of Katie Smith, who will be leaving her position as an office support specialist in CaseAid after 5 years of service. We're really sorry to see Katie moving on, excited for her, but that's going to be a big loss and a big change for our team. Katie has been that primary first point of contact for people coming into the front office, either by phone or by walk-in, for the last 5 years. She's really offers an incredible level of customer service, attention to detail, and service to the people we serve in PHHS. So we're not looking forward to that transition and losing Katie in that role, but we are actively recruiting for that position. Final staff update within the department is that we are conducting interviews for the Family Services Case Manager. This is Cooper Turnus's position that he vacated when he moved over in that internal transfer to a more mental health driven role within the department. Any questions on staff updates before I move on, or is everyone too distracted by that?
One moment, please.
9 seconds to
Is yours-
power
I think
off.
yours is,
Mine said two, but it didn't power
Press
off.
that. It's going off.
think
It
mine
said
said-
9 seconds.
okay.
I don't know what I'm doing either.
Well, I'll keep going with.
All right, go ahead.
A couple weeks ago, Martina Johnson and I met with representatives from the Department of Human Services to learn about the review process coming up for our home and community-based services lead agency review. This is one of our most significant audits that we undergo as a department in reviewing our work, serving primarily older adults and persons with disabilities. So we had a kickoff meeting. Our review will be in October. Our last review was in fall of 2016, so this is something that doesn't happen annually like many of our other audits, but every several years. And the purpose of this audit is to monitor outcomes and compliance and then share innovations and feedback. So there's a kind of a cyclical learning process where the department can learn about things that we're doing, perhaps that are unique in our very remote area. This will involve on-site review of case files, interviews with case managers and supervisors, and there may be remediation and corrective action if there are findings during that review process. Within our economic assistance unit, we are actively seeking public comment right now on our Child Care Assistance Program Fund Plan. This is a plan that we're required to develop every 2 years to detail some of our agency-specific processes for delivering child care assistance to residents of Cook County. So that plan in draft form is posted on our website and available for public review up until September 6th. And then our next step is to submit that to the Department of Human Services Commissioner for final review and approval. And this would be for next year, the next 2 years. Last of my agency updates, before I hand it over to Grace to give our COVID update. And then I'm going to give a little more narrative around the budget update after Grace gives her update. Just anticipating there might be more questions there. But we met with the supervisor of Ascend Services, newly appointed into this role on Friday. Grace and Martina, Grace Bouchard, Martina Johnson, myself, as well as representatives from Grand Portage Human Services to learn more about their plans to rebuild a team here in Cook County. We met with, her name is Kristen Hale. She's new in that role, but she has been working with Ascend for a number of years. Some of the pretty significant barriers that they have to filling those positions right now is that they don't have a physical office space in Cook County. They lost, or they didn't renew the lease where they had been located previously out of the Coldwell Banker building. But we had some creative brainstorming around who they might reach out to learn about opportunities to find a place to be physically located. Presently, Kristen is seeing some people here in Cook County, but is just doing that in the community. So again, some pretty significant barriers to reestablishing those services locally, not having staff or a physical office location to provide services out of. But it was my sense that Kristen was very responsive to hearing about what some of our concerns, needs, and priorities are as it relates to rebuilding those mental health services in Cook County. Any questions about my department or staff updates before I hand it over to Grace for the COVID situation update?
Madam Chair, I don't have a question, but I would like to take care of the beeping before Grace's update, if that's okay.
That's fine. I'm happy to wait. I don't know how to help you with the
Where's it
beeping.
coming
No, I don't understand. Grace, do something.
All of ours keep,
No,
they
that's
keep
not why I'm
coming
here.
back on after they go
8
out.
second to power up.
But it doesn't power off.
But it doesn't power off, yeah.
Yeah,
It just repeats
pull
the cycle.
plug.
There you go.
Well, it was his idea. I just talk louder.
So,
I don't know.
all right.
Just remember next time that they're not plugged in.
Plugged in,
What
yeah.
did we learn?
I'll just say
All
while
right.
you're working on that, that as far as the updates with our COVID-19 response, our plan is to be somewhat dynamic in how we bring those forward, going forward, depending on what's happening locally. So you might see this in the form of a written report submitted with the agenda. I might be bringing forward updates from Grace and the department as a whole, or in the case of today, where there's a lot going on, some pretty significant changes, and anticipated that there might be questions, Grace will be coming in person to provide the update. So very glad to have Grace here this morning to give the update.
Thank you, Allison, and thank you to the members of the board for having me back. It looks like the beeping is done, so I'm just going to go ahead and start. So I guess I'll just start with a background about what the Delta variant is and why this is a new era in the pandemic. So the Delta variant of COVID-19 is now the most common variant of COVID-19 in the state of Minnesota and the country. And the reason this is significant is that it is about twice as contagious as the previous strain, B117. So that means it passes from person to person about twice as quickly as what we were seeing before. The reason variants occur, and they occur with all types of viruses, is when they spread quickly through a population, then there's more of a chance that they can change and become what we call a variant of concern. So a variant of concern is something that spreads more quickly or makes people more sick. And so it happens most commonly in a population where there's not immunity through prior infection or vaccination. So in this case with Delta, it developed in India, a country that was largely unvaccinated. So it ran through the population and mutated and changed and became much more contagious. And now it's here in the US and in the state of Minnesota. The symptoms and the testing are exactly the same as they were for the previous strain of the virus. So if people are feeling sick, we absolutely recommend getting a test. And people who aren't fully vaccinated against COVID-19 remain extremely vulnerable to this variant because it spreads so much more quickly. People who are vaccinated should have some comfort in that the vaccines we have continue to work very well. We do see breakthrough infections, and the latest statistic on that is of all the new cases in the state of Minnesota, 0.24 of those cases are breakthrough infections. The rest of the infections that we're seeing come up positive are among people who are not fully vaccinated. So although fully vaccinated people are much less likely to become infected with this new strain, in the rare case that a person does become infected in what we call a breakthrough case, they're much less likely to be hospitalized or die from COVID-19. When we do see infections happen, these breakthrough infections, one thing that we're now seeing is that you can still pass the virus on to other people around you. So that initial amount of virus in a person's body is the same, vaccinated or unvaccinated, but we do see, because of the vaccination and the immune memory that a person's body builds up through the vaccine, that people who are fully vaccinated are able to clear the virus out of their system much more quickly, so they're not infectious for as long as a person who's not vaccinated, if that makes sense. So that is why mask use has come back, essentially. So now the public health recommendations are, again, kind of based on like what I think of as like a layering strategy. So the CDC specifically says in areas where there's high or substantial transmission of COVID-19, we should really work hard to layer the different strategies of protection that we're using in the population. So vaccination is still the most powerful tool we have to slow this thing down. However, wearing a mask can be another very helpful layer. So even if you were to be one of those rare breakthrough cases, able to pass the virus along to others, you have that additional layer of protection, not only for yourself, but for other people around you. The CDC has a new map that they're updating daily, and I'm going to include some notes with a link to this map. They update it every day, and they base, it's kind of a color-coded map. I think of it similar to like the fire danger map, but they have you based on like a low, moderate, substantial, or high zone of transmission based on how many cases we've seen in the last week and what the percent of tests coming back positive are. So typically, if we see more than 5% of tests coming back positive, that means we don't have enough testing to capture all the people who are getting sick. It could be, initially because we didn't have enough testing available. It could also be because people are just choosing not to test if they are sick. So that's one measure that we can use as sort of a way to get at how much of the virus is spreading in the community. So let's see here. Related to the Delta variant, but not entirely due to the Delta variant, across the state we're seeing hospitalizations rise rapidly. And that affects us locally because our local medical facilities need to be able to transfer patients who need a higher level of care out to our regional medical partners. And that has been a challenge. So one of the reasons for really advocating for us to keep up the good work with vaccinations, mask wearing, and other public health recommendations like staying home or getting a test if you're feeling sick is to really take that pressure off of our medical system so that it's able to continue to serve the people in our community who need care when they need care. So locally, our case count is at 183. We've had 5 cases in the past week. That's the most we've had since spring in a week. There's a bit of a lag between the CDC's website and what we see in real time, so we're still considered a county of moderate transmission by the CDC. I'm anticipating that's going to go up to substantial or perhaps high, depending on what we see here in the next few days. There's about a 4-day lag from what I see on the CDC's map versus what I see actively coming in through our lab. But the state has been considered an area of substantial transmission for over 2 weeks now. So back on August 6th, we returned to strongly recommending mask use alongside vaccination in public indoor spaces. And that's because we don't have a static population. So even though we were considered moderate transmission with the number of people coming in and out of the community and the state at large and the country at large being considered substantial or high transmission zones, it seems like the most cautious recommendation that we can have and really more realistic based on what we're seeing in terms of people moving around. So in terms of do we know whether these 5 most recent cases were Delta, we don't. For the genetic sequencing, that happens at the state level, and it takes 2 to 3 weeks, and they're only able to sequence about a quarter of the positive tests that come. So I think it's safe to assume that some of these cases were Delta, and if they were not, then we will start to see that soon because it's, the predominant strain throughout the state and the country, and we're connected to the state and the country. So, on to some better news. Last week we did have an even 100 vaccinations take place locally, spread between events at Bluefin Bay, the Community Center, and Sawtooth Mountain Clinic. 25 of these 100 individuals were teens aged 12 to 17, bringing our total teen vaccination rate for first doses to 49% for 12 to 15-year-olds and 52% for 16 and 17-year-olds. We are working with Sawtooth Mountain Clinic to facilitate 3rd dose booster shots for COVID-19 vaccines for a very select group of individuals. The FDA did recommend booster doses for a very small group of people with certain weakened immune conditions. So that would be cancer, chronic use of steroids or other immunosuppressive drugs, HIV, or recipient of an organ transplant. So that update came out Friday evening, and I'm working with the clinic to be able to put out both a public outreach strategy and to have some individualized outreach through the care coordinators at the clinic, reaching out to people who meet those very specific conditions that are now recommended for a 3rd dose. And the reason that they're recommending it for this very specific group of people is that what they're finding in the research is that people with these conditions often don't create enough of an immune memory and immune response with the first 2 doses to have an adequate level of protection. So the 3rd dose is bringing that level of protection up to a higher level for that group of people. finally, with all of the changes happening, we are actively working on revamping and increasing our community messaging regarding mask use, vaccination, and the Delta landscape of COVID-19. Thinking about coming up with a number of PSAs for the radio, and very open to other ideas as to how we reach people and get the word out there. I know that people are tired and that some people are confused, and we really want to try to stay ahead of this with providing why it is that we're recommending what we're recommending and building trust with the community. So that is my update.
Thank you. That was a lot of information.
I know.
Thank you for all your work. I listened to you, actually listened to it this morning, your interview with Joe Fredericks yesterday, so I appreciate hearing that. I do have a couple of questions.
Sure.
So the 5 cases, do you know if those are vaccinated
So
persons yet?
to date, we've had 4 breakthrough cases total, and one of our last 5 was a breakthrough case.
One of the last 5. Okay, and I was doing some reading earlier in the week, and there's a difference between breakthrough infection and a breakthrough disease.
So I would imagine that that's referring to whether a person is symptomatic.
Yeah.
So one of the updated recommendations with Delta is, so for a period of time, if a person was vaccinated, we weren't recommending testing or quarantine because we were just that, the data was showing that the vaccines themselves would provide enough protection that that wasn't needed unless a person were to feel sick. At this point, they are recommending testing 3 to 5 days after a person has been exposed, regardless of whether they're vaccinated. So I'm imagining what that refers to as a person who will test positive but not show symptoms. So the disease would be the person who tests positive and does have symptoms, and that the infection would be the person who does not have symptoms and tests positive. And just to make it more complicated, the person with the breakthrough disease would also be a person with breakthrough infection because, they still have a positive test.
Yeah.
Is that
All right, yeah. No, I was really confused when I was reading that report, and I was like, oh my God, it's getting over my head now.
Well, I think that's one of there's just so much information out there that one of the ongoing challenges with the response has just been how do we put our message out there in a way that there's just so much messaging going on about COVID that we can try to, reach people where they're at, answer their questions, and just make people, let people know that we're here to answer those questions. And we have been getting an uptick in calls with questions, so.
Yeah, and I would like to say again, I would like the hub site to go back to reporting
Yes.
the way it did before, because if we really do have this uptick, I like seeing how many tests did get run through here and how many were positive, and
Sure.
it's so hard to find that on the MDH site.
I've had a few other community members reach out, and I actually sent an email to Kyle this morning saying that we're going to have to go back to that. So
Yeah.
we're in the works with getting the
Okay.
hub back up.
Thank you. Yes, go ahead.
Thank you. Grace, according to the news this morning, anyone who's had their vaccine previously will now be eligible for boosters starting in September, irregardless of the immune compromised. So does that mean you have to kick back into, using the community center, having everybody come back in for their booster?
Well,
How do you envision that?
potentially, yes. Something that has been challenging has been that even for us in the public health system, the timetable shifts. And so, there are a few things that are other examples of that, like when Pfizer would be fully approved or when Moderna would be extended down to 12 and up. So I kind of put this in that same bucket. I think it's wise for us to begin planning for booster doses, but I'm not sure that it will be, September 1st, that's okayed, and then we move forward with that. But I think it's wise for us to prepare. And one of the things Andrea Tofty completed in the end of her service as a temporary staff was a really nice written report on how we managed all of the logistics of mass vaccination, so that we're able to refer back to that and see down into the nitty-gritty of how many how many vaccinators for how many people, how many shots per hour, how many Minnesota Responds volunteers for a given size of clinic. I do want to start looking into additional spaces where we could possibly do vaccination in case the curling rink is used for curling. We need to have a backup as well, but I think it's a possibility. And so I'm not sure exactly when, but I think we should be prepared.
Any other questions for Grace this morning? Go ahead.
Thank you, Madam Chair. I don't have any questions, but I just want to thank you again for your, I'm sure, very frustrating and unending work. And just really, really appreciate how clear and concise you are, both in interviews as well as presentations, and how how incredibly lucky we are to have you in our community. So thank you very much, Grace.
Thank you, Commissioner Mills. It's my pleasure. It's good to have, it's definitely considerable ongoing work, but I feel very fortunate to have a solid team of support throughout the community. And so, yeah, I feel very fortunate in that regard.
Well, thank you. Appreciate you making the.
Madam Chair,
Yes,
if
go
I
ahead.
could. Thank you, Grace, for your presentation. It was very well done, as Commissioner Mills said. In preparing for this meeting this morning, I had concerns about the fact that we're all up here on the dais, and, we've been vaccinated, of course, and we're masking. But the uncertainty now with the Delta variant and not knowing how to look at the risk of these kinds of things. And I know if we're following best practices, our risks are lower than if we were not. But I still have concerns and wonder about, are we looking at potentially needing to resume or do meetings in a different way? I know that for the foreseeable future, under state statute, we have to have in-person meetings, and I think that's generally a good thing. But I also worry about, the safety of doing so. And so I just wonder if you have any thoughts about where this might be going in terms of that. And maybe that's a question you.
I can give my best answer, but unfortunately I can't predict what the future will
Sure.
hold. But absolutely having a virtual meeting is less risk than having an in-person meeting, and having an in-person meeting with ventilation and masking is less risk than if we weren't wearing masks and we didn't have the windows open. So it's one of the things that's hard is that there is a level of kind of gauging risk and comfort with risk, and when it comes to state statute, that's a whole other kind of consideration to take into effect. I think what I would advocate at this point is that kind of ongoing preparedness planning, so that if we do have to pivot back, all the systems and workflows will be easy to pick back up. And of course, if we're able to, if things go down, we don't see as many cases, things become more under control with Delta, then we could easily kind of shift back. And I know that uncertainty and that possibility of moving back and forth is tiring. I think that's part of, why the community at whole is tired, because it's a lot to be gauging that risk on an ongoing basis. So I would say, to the extent that we can, just planning for all possibilities and being ready to pivot is really all we can do at this point in time.
All right, Commissioner.
Grace, with the new infections we've had, has your organization been able to do contact tracing?
We have, and I'm very much looking forward to the additional public health educator coming on board to support the contact tracing as well. But thankfully, we have a very strong partnership with Grand Portage Health Services, and both Jen Sorensen and Alexis Eliason at Grand Portage have been just amazing members of the contact tracing team. I've also cross-trained, and I've started to do more of the actual contact tracing at this point. And so we're still able to do the work. But again, similar to the question about scaling up and scaling down, it's that, how do we build something that can expand and then, contract if we don't have as much work to do? So at this point, we're okay.
Any Any other questions or comments? All right. Thank you, Grace. I really do appreciate you being here in person with us to give us our update.
Absolutely, and feel free to reach out with additional questions. I'm always happy to talk.
Thank you.
Thank you.
Thank you so much, Grace, for your report. And also just want to mention for any members of the board here or the public tuning in that if you haven't had a chance to listen to Dr. Michael Osterholm's interview on WTIP on Friday, really, really incredible but well-deserved recognition of Grace and her role as really being that trusted voice of public health in our community, along with Dr. Farshman. And want to, again, thank and recognize Grace for all that you've done over the last year and a half, and really thank WTIP as a key partner as well in helping us get information out to the community, even though it is very dynamic, changing rapidly, very confusing, that platform to be able to get the message out has been incredibly helpful for our community response. So thank you, Grace.
Absolutely. I'm always happy to talk about COVID-19, and one day I'll be happy to talk about other things too. I hope people will still listen to me when that day comes.
They will.
Thank you.
We can't wait.
Are we ready to move on to budget? Okay, so in your agenda materials today was a summary update to our 2022 PHHS department budget. No action required today. This is informational only based on some changes in assumptions. So just to run through those quickly, Lori here is here as well to be able to address any questions. But based on the pending retirement of our 30-hour per week clerical position, Katie is leaving at the end of this month. We are replacing that position with a 40-hour a week position. And the justification for that is just that we can't expect someone coming in brand new to the department to have that same level of proficiency as Katie did after her 5 years of service in that role. It is a small increase over what we had initially projected for the budget, approximately $3,000 to bump that position up from 30 to 40 hours a week. And that's based on the assumption that we'll be hiring someone on maybe the lower end of that step schedule, whereas Katie in her years of service was at the top of the salary schedule. So there is a small cost differential in bringing that position up. Initially that was a 32-hour a week position, but we had bumped it down to 30 at the request of the employee. Additionally, we corrected prior year data from 2021. The 2021 budget was initially approved with a 0 COLA increase for staff. Within the general fund, a contingency fund was created to be able to cover any unanticipated costs that were a part of that contract negotiation process. The PHHS department did receive some of those funds as a transfer from the county general fund, and what we presented earlier this month did not include that amount. So the year-over-year increase in levy was actually smaller than we initially reported. And then in response to the request from our board chair, Commissioner Hawkins, we did offer a few scenarios based on a 0 increase in use, or sorry, 0 levy increase over 2021. So you can see those scenarios within the agenda attachments. So with the planned use of fund balance, as initially reported, that would be a 1.14% increase over 2021. In order to have a 0 increase from our levy between 2021 and 2022, that would necessitate a planned use of fund balance of $128,500. Any questions about the updated budget for 2022? And just a reminder,
Madam Chair, thank you, Allison. My thinking on this, I'd certainly appreciate these 3 scenarios, and maybe it gets too muddy and too complicated and too much of a pain, but kind of where my thinking has gone is a large part of the fund balance, or a potential large need of the fund balance would be out-of-home placements. And so I was wondering if it would be useful for us to look at historical numbers there. I know that there's been a lot of work done proactively to address out-of-home placements, and hopefully that good work will continue, or the impact of that good work as well will continue forward. But I think it might be wise to consider the impacts that the pandemic has been having, the potential for some of the out-of-home placements to go up, and how that may or may not affect the fund balance or the need for that. I don't know if that just gets into the too far into the if-maybes, but it just would help me have more perspective on, if we did get a 0% increase and we had more out-of-home placements because of the stress factors of the pandemic, just how that might, what kind of position that might put us in down the road beyond 2022. So I'm just trying to think further out, and I know with a lot of this we can't, but I'm really trying to take a prudent approach to if that's something we might want to look at. So is that too onerous to?
If I may. The initial budget that I presented a couple weeks ago did show a $100,000 planned use of fund balance. That was the contingency for out-of-home placements. Out-of-home placements, if we could say that every one of them cost the exact same amount, right, then we could take a look and we could say, well, we had 16 of them a couple years ago, we had 9 of them 2 years ago, and therefore, we could probably plan for something for going forward. However, out-of-home placements, the cost per day per child is based on the level of child's need and where they're being placed. We have children that can go into shelter placement, foster care within the community, residential foster care. They can go into treatment. They can go to out-of-state treatment, the correctional placements. Those are all different types of placements that can range anything from $27 a day to $450 a day. There's absolutely no way to gauge what the level of need will be and then associate an exact cost to that. So that's where we took a look at what is a combined total of out-of-home placements that we have incurred in each of those categories. And then we look at it and say, okay, well, we had X dollars in this year and X dollars in that year. We budgeted for that X dollars in this coming year. I don't think we're going to be able to meet that cost this year. Let's say, well, we're going to use $100,000 of fund balance if that need exists again going forward in the following year. So that's where the initial plan of $100,000 of fund balance came from. The difference between using that $100,000 of fund balance and having a 1.14% increase in levy from 21 to 2022, if we wanted to bring the levy down to having a flat 0% increase over 1 year to the next, we would plan for a use of fund balance of an additional $28,500. That would just bring our levy request from the 2021 budget to the 22 budget level, stay the same. Another consideration, as we were talking about children's out-of-home placements, is there's also adult placements that occur in our community as well. Mm-hmm. And adult mental health placements, if somebody were to be placed in a state facility elsewhere within the state or out of state, that also can run $200 to $400 a day. And that these are things that the county does not get reimbursed for because the county of financial responsibility. These are things that we are tasked with providing those, the funding for that support for that person. So in answer to your question, I really wish we could. I wish we could just plug in a couple numbers, because I'm all about the Excel spreadsheets. I plug in this, plug in that, what's my answer? And there's so many different variables that would come into play that it's not possible, which is why I recommend just having that contingency there for the use of fund balance if the need exists.
I greatly appreciate that explanation. Thank you very much. And yeah, I should have known that you had factored that in and considered that and looked at the possible, what we could possibly know and not know. And so I really appreciate that. That was my biggest concern, and just not wanting to set us up for years out to have to again make up for it. So yeah, thank you.
And I'd just like to comment that I think this is a very conservative budget as far as planning for revenues and knowing what, we still don't know exactly what the state is going to be doing for the next year. I kind of think, I feel pretty confident that, especially with $1 million addition to fund balance last year's budget, that this can continue to get tweaked, and I think we can get to 0% no problem, and not even have to add the extra 28.5, but we'll see what happens.
And just a reminder, for our next steps as a department, we'll be bringing this budget as a presentation to our Public Health and Human Services Advisory Council in a couple of weeks to get their input. That's one of their statutory responsibilities, as well as to advise the department and the PHHS board as to our plan for delivering services and our budget for the next year.
I'm choosing my words carefully. Because I very much would love 0% increases for everything. And I think that would be wonderful. I want to be careful as a board that isn't the goal, right? The goal is to provide the services that are needed for our community. And if it so happens that we can achieve that goal and have a 0% increase, that's phenomenal. But personally, one of my goals is a long-term stability, because I feel like the organization and our community has suffered through a lot of instability. And so I'm very leery of 0%, because then I feel like we're not meeting the natural cost increase that happen. But to your point, Commissioner Hawkins and Madam Chair, there are certainly ways to plan for long-term stability without unnecessarily raising the levy. So I do appreciate the downward pressure on that, but I also want to make sure that's not the focus as much as it is making sure we have long-term stability there. So I just find myself getting into a little trap. So I don't want to get us all into a trap.
Thank you, Commissioner Mills, and I agree. We need to make sure that our budget makes sense, and we're planning for the future, and we're looking at everything. But we need to remember, this department is not a silo in our job, and we need to make sure we are using taxpayer dollars in the best way to provide the services that the taxpayers want. So that's what I'm saying. If we can get to a 0 here, I know we're going to have another request before us soon. That money has to come from somewhere, and I prefer not to tell the taxpayers, you got to keep adding to our fund balance.
Yeah, right. For it to sit there.
Right.
Yep.
So I'm all for making sure what we do makes sense and raising questions. So that's why there will be more tweaking, I'm sure, in the next few weeks, and we'll get another opportunity to have some more input. So any other questions or comments? All right. Thank you.
All right, well, I'm going to shift us back to current year budget for an update. This was an addition to our agenda this morning. Commissioner Hawkins, I don't know if this was incorporated as a modification to the agenda. When the consent agenda was approved, I was paying attention to our technology, so I apologize if I didn't prompt you to do that. But just wanted to at least give a narrative update, if this wasn't formally acknowledged as a part of the agenda, about our plans to modify our approved use of fund balance in 2021. So this is the time of year where we're talking about 2022 budget, we're in 2021, we're doing some 2020 reporting, what year is it? But this is the 2021 budget where we had received approval from this board to use up to $45,000 of our fund balance to offset the cost of our temporary public health staffing that were extended through the first half of this year. So we will not need to use that fund balance, as we were able to secure funding through our Regional Community Health Board and other public health grant funding sources. So that will be an additional add to our fund balance for this year. I brought this proposal. I've been working closely with both James and Brian and brought it forward through our building committee on Friday to share our plans for modifying some of our office spaces to better fit our needs within the department. As you may be aware, WOLD several years ago, in looking at our current and future projected space needs for our staff in PHHS, recommended actually moving us out of the courthouse and building new construction to be able to suit our current and projected staff needs. Based on where we are right now as an organization with capital planning and facilities planning, we, as a department and in close consultation with James, Brian, and Brady, have been working to develop a plan to make the space that we have currently fit our needs for our staff. So we have been working with Northern Business Products, who is a regional vendor who we've worked with in the past to modify workstations and add new workstations within our department. And we are proposing to redirect a portion of that approved fund balance that was initially approved for public health staffing to purchase size-appropriate furniture for staff within the department by modifying some of our larger offices, mine included, as well as the offices of a few of our supervisors, to have 2 staff working in those spaces. So we will be moving into smaller offices again and putting 2 workstations in some of our larger spaces. One of our additional offices currently has 2 large workstations that will also be modified to accommodate 2 smaller, more functional workstations for those staff. And then our plan is to use some of the used furnishings that are moving out of these spaces within the department, where we have people who have maybe a portion of a desk already from a larger. We have throughout the county the 90s era large workstations that just don't work with how we've squeezed multiple staff into some of our offices. So we already have situations where a person might have just one section of a desk and not the full. So we'll work to use what we can to repurpose within PHHS or to make available to other county departments as well. And then consulted with Brady about options for having a sale or otherwise making use or getting any revenue back from those desks that we won't be using. So again, we checked with Brady about the process for a budget modification for planned use of fund balance. Brady said that there isn't a specific process or form that we would need to take, and there wouldn't need to be any formal board action, but I wanted to let you all know that this is our plan and share some of those real dollar amounts about what the budget estimates are for this project. Any questions about that?
I just appreciate you informing us and really give you a lot of credit for making the space that you have work, because it's very difficult given the number of people that you have. So thanks for your creativity and striving to make it work for everyone.
Thank you, Commissioner Sullivan.
Yes. Do you think because of the variant that's going on around everybody again that you'll be having more people work at home for a while?
Yeah, that's a really great question. I thank you for bringing that up, Commissioner Storley. As we have looked at creating more shared workstations, we've done that with an eye towards where staff have jobs that require them to be in the office more, in the community more, or have more opportunity to do telework. So where we have offices with shared spaces, for example, I'll use our fiscal team as an example. Lori is moving out of her larger office into a smaller office, and 2 fiscal staff will be moving into her space. That's one of the smallest in terms of square footage, where we'll have shared staff. But those 2 staff, because of their current and anticipated ongoing telework option, they're only in the office on the same day, 1 day a month. So it's a pretty minimal impact in terms of the physical health implications of being in a shared space.
Any other? Go ahead.
Yeah, I just also wanted to thank you for your creativity with making things work, and want to recognize that your office will be downsizing, and that you won't have that that meeting space in your office, which I think can be problematic or challenging, to say the least, to have team meetings and just to run the department. So thank you for doing that, and also I'm sorry that you're doing that, and I'm hoping we can somehow get a more comprehensive picture of where we can move things along. So whether that be the ramp entrance remodel or a new facility or whatever. Thank you for making it work for now.
Thank you, Commissioner Mills. And I'll add as well that as a part of our plan in shifting people around, one of our additional goals was to create more private meeting space for our human services staff to be able to have those confidential face-to-face meetings with people when that's the best way to meet their needs. And we are netting 1 additional private meeting space with all of these shifts. So that will be a benefit for our staff, and then potentially for me as well if I need to meet face-to-face with someone. But in my new spot, I'll be right across from our conference room, so I'll be able to just peek up and see if it's open.
Very good.
Thank you, Allison. Any other comments or questions? All right. Thank you very much.
Thank you.
All right. We're down to committee reports. Commissioner Mills.
Madam Chair, I believe it's Commissioner Swalson on the Active Living Steering Committee.
Sorry. Skipped you over. Sorry.
Our Active Living Steering Committee actually was a 2-part. It was Safe Routes to School initially, and then we moved to Active Living. And on the Safe Routes to School, of course, the big news was that we had gotten that approved to move forward. The bigger news, of course, came later when Andrea told us she was of her new opportunity, and she was moving on from that, of course. But we were still pretty excited about achieving that major goal on the Safe Routes to School aspect of it. And also a lot of discussion and moving the support to be able to do the bike rodeo that was set up. And I was glad that that was able to move forward and achieve that. So thank you, Andrea, for that. On the Active Living Steering Committee portion, the Bike Minnesota chapter designation has been signed and returned, and then they had a good discussion with the, for the new section of Gitchigami Trail, and also they were really anxious to work with both ourselves and the city on anything they could do to help with grants or anything to get the signage and things that were going to be very important for the community to make that the new routes through town and signage to bike racks, this type of thing, make it more effective for everyone, so that looking forward we could start to plan out community rides, do that type of thing. And so they're really anxious to be involved with us and assist in any way that they can. Andrea, did I forget anything key to?
I think that covers it. We're really excited for School Zone.
Yep.
And the signage, Robbie got the 2 estimates that he was looking for, and he said there's a slim chance that they would be able to start this fall, but it would most likely be in the spring.
Yeah. And that's it.
Any word on painting the crosswalks yet?
We do that in the spring,
Okay.
so.
That's a spring activity.
Because
Kinda hoping it was gonna happen
right.
soon.
So the situation with that is that even though it's a county road, the city is the one that does paint the crosswalks on that street, because the Safe Routes to School Committee and the relationship that we have, because they're already painting crosswalks throughout the town. So I did have a conversation with Lenny at the city, and he said it's easy enough to add, but in order to do it separately, they would either have to get their whole machine out again, or we would have to have it painted by hand. And so it'll be in the spring when they do the next ones. Or when they repaint the ones that are in, they'll add the high visibility to that intersection. It's
So I can go out in the middle of the night with my paintbrush and highlight?
I used to joke about that too, but apparently that's illegal.
Oh,
so.
okay. I wouldn't do that then.
Right, I know, right? Yeah, so it's in the plan.
Okay.
Just because it's a lot of work to get the machines out and to clean it all over again, and costs a lot of extra money just to do one crosswalk, so.
All right, thank you.
Yeah.
All right. AEOA. Now we're to Commissioner Mills.
Thank you, Madam Chair. We have a meeting tomorrow. I can't think of what to report on the last meeting. It has been, I guess, too long. What I will say is that in our community here locally, there's been significant renewed interest, I'd say, in both the weatherization and the heating assistance monies, and both from the Cook County Local Energy Project as well as the city's sustainability coordinator. And so I know there's been significant challenges at AEOA with getting people up here. I mean, as you can imagine, there's a worker shortage, and getting people up here, and just the demand has been so great. And then there's also been transitions, and then COVID, and so I'd say there's been some frustrations on our local end with the level of service that's been happening in our community, and AOA certainly recognizes that and wants to do more and is working towards that, but it's a very large ship that's needing steering there and kind of slow to move. So I'm hoping to have a better update from tomorrow's meeting, but I have had I did have a meeting with Scott Zahorik, and who is the AEOA director, and is it Dave Johnson, who's the director of housing with AEOA, and then Shane Steele, about trying to get better coordination and communication lines and just getting flyers out to people. So I think if we can get a higher demand, they can more easily get people here from Virginia, so, or wherever they contract from. And I think that's probably all I have to update on now.
You want to just move on to item C?
No, yeah, thank you, Madam Chair. AHA, let's see. So there had been significant talk, very, very promising talk about the kind of statewide standardization of telepresence. And there was a symposium and a lot of interest, and then I guess it died in committee, unfortunately, by one vote. And so I think that it's received a lot of attention, and whereas it may be dead as far as policy is concerned right now, I think people still recognize the need and the value, and that the coalition that was formed will continue. It's just we're not going to get any laws changed or made right now with that, unfortunately. Otherwise, I was able to sit in on presentations for requests for proposals for both mobile crisis and the crisis line, and that was very informative. And Thrive, who operates the Birch Tree Center in Duluth, was doing both the mobile crisis and the crisis line, and that was, they're in negotiations with what's going to happen, but there were other interested parties, and it may be divided up as far as the responsibilities there, both the crisis line and the mobile crisis, or mobile crisis response, and so we'll see where that goes. And otherwise, the Clarity Project, I think, is moving along, and that's very exciting for behavioral health services in Duluth. I think that's all I have there to update on, unless you have questions that I may not be able to answer.
Thank you. Item D is Arrowhead Regional Corrections, and actually I don't have anything new to report. Commissioner Spallison and I will be attending the meeting on Friday in Duluth. Unless you had something to add, Commissioner Spallison? Okay. All right. ARDC, Commissioner Storley.
Thank you. Nothing from last month. We are meeting this week. We're going to meet in person, 6 feet apart, with masks, and bring your own water. So we'll see how it goes.
Thank you. Commissioner Mills, back to you.
Yes, the CHB Community Health Board. I guess one kind of very relevant thing is the grant funding. That was the added item on our agenda here. So that was kind of big news, and let's see. We had a presentation on how. What was it? No, that was 2 ago. The breakdown of needs, and there was the dashboard. Can you weren't at that. Were you there?
I missed the last meeting, unfortunately.
Right,
I had several
yeah.
conflicts. Grace was in attendance representing the department.
So there was two presentations, one last time and the one time before, and both had dashboards from the state, and it was just very useful to see by demographics the health of different regions. And so I can forward that on to this board, but we can go in and kind of break down the health of each community and whether it be substance use, tobacco use, diabetes, obesity, and income, and it's just all broken down, and it's very almost overwhelming, but you can really dig into the data, and it's also a really powerful tool. So had a presentation on that, and that was probably the biggest takeaway for me from that meeting.
Okay. Yeah, I would like to see
Yeah.
that if you want to send that
Absolutely.
out. Me and Data,
Oh yeah, for sure. You'd love it. You would.
So, yeah, I'd love to see that.
Mm-hmm.
If I may, Madam Chair, that I'm just looking back at the agenda, and that was an overview of our Bridge to Health survey, which is the regional survey of health indicators that's done every few years, and that data will inform our community health improvement and assessment planning process here locally, both as a department and with our community partners, as we revisit our current plan and look at what has changed in the last few years, especially due to COVID, and how can we work together to prioritize what needs and areas for action are for the next 5 years.
It also compares the whole Bridge to Health region as well as just by counties, and then statewide, and then is it nationally as well? I'll have to look at that, but it was just lots to compare and look at and take away from.
So is this new information, Bridge to Health? Because, from the last report, or is this, they redid it?
It's
This
every
new
5 years, I believe.
Okay.
Yeah, and so this is the updated one.
Okay. I'm sorry, anything else? I didn't mean to interrupt you there, sorry.
Well, no, Allison was helping me. And I think that was it from the CHB.
Okay. And then we'll move on to the Local Advisory Council. Andrea. You have something to report for your...
Yes, lots of things to report. So I was actually traveling that day to pick up the bike helmets for the rodeo vaccination event. So Rena was the chair for the meeting. We talked about the gaps in services, mental health services. And then we also worked on our mission and vision process. And we made some really great strides, actually, so that was refreshing. And then Rana was voted to be the chair of the committee, and Pam is the vice chair. So, yeah, exciting stuff.
All right, thank you.
Did I miss anything? Because I didn't take any notes.
Well,
I was driving.
yeah, if I may, Madam Chair, there's just a lot of conversation about, it's just a really good group of people and just a lot of conversation, very, very sincere, heartfelt about the different needs in our community and just the gaps that people are witnessing or experiencing and just the challenges that everyone's going through. And every single one of those meetings, like, it's important to have mission and vision and to take care of business, but so much of it is just that really personal, I'd say, personal stories. There's just a lot of value there that you don't necessarily see in other groups and committees so much. So, yeah, it's just a really, really powerful group.
Thank you. Let's see. Oh, Restorative Justice Committee. Actually, we're meeting tomorrow, so we can give a report next time. Council on Aging, Commissioner Sullivan.
Thank you, Madam Chair. Well, we had a work session for the Cook County Council on Aging yesterday, and they're in the process of updating their bylaws and their application for board positions. So that will move forward for approval by their board later this month. They have enacted a masking policy regardless of vaccination status at the hub. And it was very well received. They started last week, and high level of compliance. One of the discussions yesterday was, are other groups that are using the hub in the evening or on the weekends complying with that? So Bev Green, their director, is going to be checking into that. But they have a lot of concerns related to the rise in COVID because of the vulnerable population that is served there. They are noticing the number of meals are down a little bit, and they feel like there's some reluctance to get out in public, so they just want to stay on top of things and want to keep in good communication with our public health officials so that they're best serving and meeting the needs of their population. And that's it. Any questions?
Thank you. Right, Emergency Preparedness Committee. Commissioner Mills?
Yep, COVID and fire.
Yep.
That's the sum of it. And of course, fire danger is extremely high. New fire bans out there for all fire on private and public lands, and then of course the conversation around Delta variant with COVID, and we had an update this morning here, so we don't need to go over that again. But that's about it. Unless Commissioner Sullivan, you had anything?
I would agree.
else?
It's
Yeah.
just all hands on deck for COVID and fires.
Yeah, it's a scary time out there, that's for sure. Commissioner Storley, Healthcare Planning Committee?
Well, hopefully we'll start meeting again in September. So we've been cruising through the summer. Anybody who has an update, will let us all know, but we haven't had anything. So because that's so boring, I want to say, welcome, Rana. Because I know she's very organized. We work together on another board, and she's well equipped to work with us and add to your group. And so just wanted to mention, I appreciate you stepping forward to do this, Rana.
Yes, we're happy to have you here. Thank you, Commissioner Storley. Anything to report from NACO?
Well, I think everybody's worn out from having both a virtual and an in-person NACO meeting out on the East Coast. So nothing now. We'll start meeting again in September.
All right, thank you. Commissioner Mills, back to you.
NemoJet Northeast Minnesota Office of Job Training Program. There's some concern about a shift in funding, a shift in focus. Not exactly sure how that's going to pan out. I don't know how much Cook County will be affected by this, but as a region, it looks significant. And anytime there's a big, and this is coming from the state, and anytime there's a shift in or a change, it makes it difficult on an organization, and just kind of having unsettled footing, I guess. It's not really clear, but it could be significant for NemoJet here. But I'll update if there's any impacts, especially locally. We'll certainly hear about it.
All right, thank you.
North Shore Collaborative is next.
Go ahead.
Yeah, thank you. We didn't have a quorum, so that was frustrating. It meets quarterly. It had to do with hiring and other organizations, and so I have to recognize the importance of that, absolutely. This particular meeting, we didn't have any grant applications either, so that made it not as consequential, or not as many. And with that, I would encourage any local organization to check out the North Shore Collaborative's webpage to see if the grant offerings would fit their organizations, because there is money on the table there, and the focus is on children throughout the community, and just trying to give as rich of an experience to all children. So whether that's through the arts or robotics, or they've done field trips, which maybe right now isn't the best time for that. But there's a lot of opportunities there. So please, if you're listening and you fit, apply.
All right, thank you. Mr. Linehan.
Yes, Madam Chair, nothing to report as we didn't meet this month. I've requested we move back to Zoom meetings. We were going to try starting a hybrid form on September 7th, but I'm hoping we can go back to Zoom instead. One thing I thought about after Grace had already left, and I'm wondering if it may not even be appropriate to do so, but does the Public Health Board want to support through a motion or some other means the work that the Public Health Department is doing around the COVID and the masks and the vaccinations and that? Is there anything we need to do or could do to make that obvious that we are very supportive? I'm just wondering how we would do that.
I don't have any experience, Mr. Linehan. I'm open to ideas. Commissioner Mills, go ahead.
And anyone else can chime in here too. I don't know that there's anything formal that needs to be done,
Okay.
but I think it sends a really good message, and that's something I'm reading about more just nationally, regionally, about kind of the need for leadership and support of public health more, and again, just because of how long this is going on and how draining that is on everybody, and especially those that are really trying to protect the health of the public here and promote it. So I think that's an excellent idea, and it might be more of a gesture, but a very important one, I think.
Well, maybe what we could do then is I could make a motion that the Cook County Public Health Board continues its support of the public health department efforts towards protecting the community through masking and through vaccinations, and that we are very pleased with all the hard work that has been done towards protecting the residents and visitors to Cook County. So maybe that's what to say.
I would second that.
Thank
All
you.
right, thank you very much. And you got all that wording down in your the motion, right? I was trying to
It's
take notes,
recorded.
but, okay.
Hopefully the
All
mic is
right.
on.
I hope so.
Yeah.
We have a motion and a second. Any discussion? Hearing none, we will take a vote. All those in favor?
Aye.
Those opposed? Thank you very much. I appreciate
you.
the motion. All right. Anything else that anybody would like to bring up or mention for the good of the order? Yes, Commissioner
Yes.
Starley.
Well, I just want to thank Public Health and specifically Lori for including the proposed budget that she presented last time. The fact that, you know, they go to a lot of work and get all this done, and then we say, oh, could we have a copy? And they're right there doing it, so thank you very much from your department. Really appreciate it. That's the good of my order.
Okay. Good. Anything else? If not, I think we're ready for item 8.
Oh, I move to adjourn, Madam Chair.
Thank you. Is there a second?
I'll second.
All those in favor?
Aye.
Aye. Thank you very much. Have a great week.
Thank you, Andrea, for your service on the PHA.
Oh, yeah.
Yeah, thank you.
Thank you. Your exit, you're not going far,
And
though.
now it's too late.
Yeah.
No, yeah, thank you all. It's been really great. But it'll still be great, so.
Maybe it'll be greater.
I think it could, well, I mean, that's really the intention, right?
I'm glad you're joining the team.
Yeah, me too, I'm excited.
It's toasty in here.
One meeting after the other.
I know,
Hello, Glenn.